Hantavirus might be one of the deadliest viruses you've never heard of, and in rare cases, it can be hiding in something as ordinary as dust. Imagine this. You walk into a room that's been closed for months, you open a window, pick up a broom, and begin cleaning. Everything feels normal. But with every sweep, you may be releasing microscopic particles into the air, particles that could carry a virus with a mortality rate of up to 40%, not spread through crowds, not through handshakes, but through the air you breathe. Hantavirus is not a single virus, but a group of viruses primarily carried by rodents, especially rats and mice. Unlike many infectious diseases, it does not usually spread from person to person. Instead, humans become infected through contact with contaminated rodent urine, droppings, or saliva. The most common route of transmission is inhalation. When dried rodent waste is disturbed, whether by sweeping, dusting, or even moving stored items, tiny virus particles can become airborne. Once inhaled, they can enter the lungs and begin to infect the body. This means that everyday activities such as cleaning a storage room, opening an abandoned building, or working in farms and warehouses can become unexpected sources of exposure if rodents are present. Hantavirus infections occur across the world, but the way the disease affects the body varies depending on the region. In North and South America, it causes Hantavirus pulmonary syndrome or HPS. This form primarily affects the lungs and is known for its rapid progression and high fatality rate. In Europe and Asia, it causes hemorrhagic fever with renal syndrome or HFRS, which mainly affects the kidneys and can lead to bleeding complications and renal failure. Although the symptoms differ, both forms are serious and require immediate medical attention. The early symptoms of hantavirus infection can be misleading. They often resemble common viral illnesses like the flu. Patients may experience fever, fatigue, muscle aches, headaches, and sometimes nausea or dizziness. At this stage, it may seem like a minor illness, something that will pass with rest. But what makes hantavirus particularly dangerous is how quickly it can escalate. Within just a few days, the condition can worsen dramatically. In hantavirus pulmonary syndrome, fluid begins to accumulate in the lungs. Breathing becomes difficult and patients may feel as if they are suffocating. In severe cases, this can rapidly progress to respiratory failure, requiring immediate intensive care. In hemorrhagic fever with renal syndrome, the virus damages blood vessels and disrupts kidney function. This can lead to low blood pressure, internal bleeding, and a dangerous decline in kidney performance. A person may go from feeling mildly unwell to critically ill in a very short time. Another major challenge is diagnosis. Because the early symptoms are non-specific, hantavirus infection is often not recognized immediately. This delay can reduce the chances of timely treatment and increase the risk of complications. Currently, there is no specific antiviral cure for hantavirus. Treatment focuses on supportive care, managing symptoms and maintaining vital functions. This may include oxygen therapy, intravenous fluids, and close monitoring in intensive care units. Early medical intervention can significantly improve survival chances, especially before severe complications develop. Because treatment options are limited, prevention becomes the most powerful defense. The best way to reduce risk is to avoid exposure to rodents and their waste. This includes sealing entry points in homes, storing food securely, and maintaining clean environments that do not attract rodents. When cleaning areas that may be contaminated, it is important not to sweep or vacuum directly. Doing so can release virus particles into the air. Instead, surfaces should be disinfected first, and protective equipment such as gloves and masks should be used. Simple precautions can make a significant difference. Hantavirus may be rare, but it serves as a powerful reminder that serious health risks are not always obvious. They do not always come from crowded places or global outbreaks. Sometimes they exist quietly in everyday environments, unnoticed until exposure occurs. Understanding how this virus spreads, recognizing its symptoms early, and taking preventive measures can be life-saving. Because in the end, the most dangerous threats are not always the ones we can see, but the ones we breathe in without even knowing.
Subscribe to MedPharmaGlobal on YouTube. Get the latest medical and pharmaceutical updates. Click the subscribe button and join our community.